My name is Dr. Rob. I'm the Chief Medical Officer of Penda Health in Nairobi, Kenya. We run a chain of 19 primary healthcare centers across the city. Here in Kenya, like many other places in the world, adherence to clinical guidelines is low. This figure from the Ministry of Health shows that only about 40% of care is consistent with clinical guidelines. Our patients have a very limited budget to spend on healthcare, and so it's really imperative that every bit of that budget is spent on effective care and that it's not wasted. The solution that we're presenting to MIT Solve is a broadly implemented clinical decision support system that can be integrated with any outpatient EHR. Here's what it looks like. Here's a quick example of how Penda's clinical decision support system works. When a clinician enters a diagnosis, such as uncomplicated malaria, they'll get a little pop-up which shows Penda's guideline recommendations for that condition. Here, the clinician has already performed a malaria lab test, so the system is smart enough to know that that's already been accepted. We have patient education materials. We also have guideline recommendations when it comes to pharmaceutical prescriptions, including different alternatives that may be available. As those suggestions are accepted, they automatically pop into the medical record. Here are medications, and here's our patient education materials. Not only does this provide a really terrific point-of-care intervention for improving guideline adherence, it also gives us a quantitative measurement of the quality of primary health care. Here we can see that our branch in Embakasi over the last 1 month had 82% adherence to clinical guidelines. We can view this over time by medical center or even down to the provider level. We're also able to see our performance against particular conditions. So, for example, over the last 1 month across our entire network, we've treated bacterial conjunctivitis with our guideline recommendation of ciprofloxacin eye drops 89% of the time. We've implemented this solution across more than 300 different clinical conditions that are commonly encountered in primary care, and we've been able to achieve more than twice the national level of guideline adherence. I really love this solution because it shows that with relatively simple tools, we can dramatically improve the quality and value of care for patients in Kenya. I hope that you can help us scale this up. Thanks.